Each advanced practitioner should have their own individual learning plan, and this needs to be tailored to their learning needs and the areas of the scope of their practice. I think it's something that needs to be revisited on a regular basis so that it can be updated and becomes a living, useful document and forms part of their portfolio of evidence in terms of their progression in their role.
When you're setting out a learning plan with someone, you really need to seek to understand that person, get to know your people, get to know your team. What is it that makes them tick? What is it that drives them? What are their motivations? And what are their strengths and their weaknesses? And where do they need support? So the plan needs to encompass all of those things.
I always say to begin with the end in mind, and that actually you want to know where you want the trainee to be at the end of training, and how you want the role to progress over the next maybe 5 or 10 years. But by finding out where they are at the beginning, knowing where you want them to be at the end allows the trainee and the supervisor to work together to build a bespoke training plan to get them the experience that they need to get to the end goal.
When we appoint all of our ACPs, they will have an initial supervisor meeting. They'll talk about what their professional background is, where the gaps are, and also showing them what the plan will be over the next 2 to 3 years. So because we have a generic competency set for the trust, but then we have our specialty competencies and capabilities and the HEE capabilities, and we have an e-portfolio which underpins all that, what we do is we ask our trainees to immediately evidence against what they have already in their background against those. So say if you are already working as a respiratory specialist nurse and you've already got skills around arterial blood gas taking, then you can quickly reference that into that. So then we don't need to focus on those points. We can focus on the areas where you need more support.
Dig down to the individual themselves about where their confidence is, what they're very happy doing, what they're not so keen about, and they'll be very clear what it is in the role that they are most concerned about, and that's the bit to focus on.
So locally, all our trainee ACPs and ACPs will have a competency document that follows them around. That's evidence of the competencies that they've completed, when they completed those competencies, and actually any further areas for development. So there is a paper document that will tell you when the last review of the competencies was. I have three-way meetings with clinical supervisors and trainees to map progress, to find out where the development needs are, any further sort of competencies to be completed. So I will have a very clear database of when they were last reviewed.
We use a SMART process, which is about being specific, measurable, achievable, targeted, time limited. And other settings might use other ways of doing it, but we use that. And what that does is it focuses people.
Advanced practitioners are bright individuals, and I think we have to consider very carefully giving them a well-rounded job plan to allow them to fulfil all 4 of the pillars. The focus tends to be very much on service delivery, and we've had to spend some time with practice management to really sell the value of the other pillars of practice that come together to form that advanced clinical practice level. So we've looked at opportunities such as allowing one of our advanced nurses to lead on learning disability needs within the practice. That includes going out to learning disability care homes and looking after that client group and their needs. We've got another practitioner at an advanced level who is very involved with the rheumatology type side of things, so we've allowed them to lead on that. But we have had to sort of challenge the system in certain ways to really push that message.
An ACP could go in so many different directions, could want to learn so many things, that you might need to contain that and think about looking at it in a stepwise fashion. So not negating, the wishes of the person, but to think about, okay, so in the first year, what are the absolute must-dos and what do you need to have kind of under your belt, and let's put those down, and then let's think going further, next year we might do X. But I think it is about kind of containing and maybe being able to ask the searching question. You want to really drill down to what are the absolute kind of expectations and what do you really need to know, and do you feel that you have those skills and that knowledge, and if not, where do we get that from?